When Albertans go to the hospital, they expect timely, high-quality care. But too often, that hasn't been the reality. Emergency rooms are overcrowded, wait times are long, and that takes a toll on patients, on families, and on the frontline staff doing their very best every day. There are many reasons for the pressure in our hospitals, and we are addressing them across the system.
One important factor is that some hospital beds are being used by people who no longer need acute medical care. These are often seniors or vulnerable Albertans who are medically ready to leave the hospital, but don't have access to long-term care, assisted living, or specialized supports in the community. Hospitals aren't designed to provide that treatment. In Edmonton alone, there were 7 patients who spent a combined 6,570 days in the hospital after they were medically ready for discharge. That's 18 years. If those beds had been available, more than 1,000 Albertans could have received acute care sooner. Our parents, grandparents, friends, and children getting help when they needed it most. Because when hospital beds are used for the wrong care, it impacts the entire system. But fixing this problem and getting Albertans the right care in the right place isn't just a hospital issue, it's a system issue.
For too long, Alberta's healthcare system has been built entirely around hospitals. People are pushed towards acute care with few options to support them before they arrive or when the time comes to leave. Alberta's population is rising, aging, and complex needs are growing. Hospitals must be able to focus on acute care. Families deserve clear pathways and real support during difficult transitions. Seniors deserve care that meets their needs, supports their dignity, and provides stability and comfort.
That's why we created Assisted Living Alberta. And that's why we're building a system that's focused on getting people the right care in the right place at the right time. And that work is already delivering results in Alberta. In the past 6 months, Alberta has reduced the number of non-acute care patients in hospital beds by 20%. And this is not a quick fix or Band-Aid plan. We have a long-term provincial-wide plan that strengthens assisted living.
We're building on the progress we've made with Alberta's new assisted living framework, a clear path to strengthen continuing and community care across the province. The framework is built on 4 pillars. First, supporting aging in place. We're expanding home care, including on evenings and weekends, increasing caregiver supports and helping people access the non-medical services, meal programs, housekeeping, rides to appointments, and programs that keep people socially connected. This also means using tools like community paramedicine to provide in-home assessments and reduce unnecessary trips to the emergency department. Through Budget 2025 alone, we're investing $1.7 billion to help Albertans age with dignity in their own homes and communities.
Second, connecting patients to the right care. Dedicated teams in hospitals will help patients who no longer need acute care transition to the supports they need. Through embedding 24-hour, 7-day-a-week staff in priority emergency departments, especially those with highest volumes and the longest waits, patients will have direct support in accessing the right supports, including housing or shelter, ID services, non-acute medical care, addiction recovery, as well as basic needs such as clothing and hygiene.
Third, modernizing funding and fostering innovation. We're making sure that taxpayer dollars are going towards people, not paperwork. Funding will follow patients and be tied to patient outcomes, and resources will be directed to patient care. Through the development of an assisted living navigation portal, Albertans will be able to see the continuing care options, compare them, and make informed choices without confusion or delay. And we'll leverage data tools like dashboards and predictive analytics to spot pressures in hospital earlier, support transitions between different levels of care, and track progress.
And fourth, building for the future. Alberta's government is driving the largest continuing care expansion in the province's history. Over the next decade, we'll invest billions of dollars to build tens of thousands of new continuing care spaces all across the province. That starts with $400 million to begin building 1,500 new continuing care spaces in the communities that need them the most. That's on top of the thousands of spaces already under construction in Alberta. We're prioritizing shovel-ready projects, leveraging public buildings and land, and expanding builds on or near hospital sites. At the same time, we're investing in maintenance and renewal of existing facilities so they remain safe, modern, and responsive to residents' needs. This means fewer people stuck in hospital beds, reduces pressure on emergency rooms, and a health system that works better for everyone.
We know that strengthening assisted living is not the only step in improving acute care, but it's a critical one. This matters. By delivering care designed for people's needs, we are building capacity and making sure the right care is available at the right time, in the right place. This is how we move beyond short-term fixes. This is how we support patients, families, respect seniors, and restore hospital capacity. And this is how we build a healthcare system that is compassionate, practical, and ready for the future.